Mr. Speaker, this morning I rise to share with my honorable colleagues observations, findings, and data stemming from the operation of the Dementia Care Services Pilot Program, which was first launched by the Ministry of Youth, Social Development and Seniors in October 2023 through its Office of Aging and Disability Services. The purpose of this program is to ensure those persons living with dementia who are uninsured or underinsured have access to dementia navigation and support services. Mr. Speaker, as a backdrop for my honorable colleagues, some of whom are new to the House, dementia is an umbrella term for degenerative diseases that impact the brain. This results in memory loss and changes to one's behavior and one's thinking, which impacts our ability to perform everyday activities. According to the World Health Organization, global numbers for dementia are expected to triple by 2050. Due to aging populations and chronic diseases that are risk factors for this disease, it is estimated that up to 45% of dementia cases could be reduced through addressing modifiable risk factors for dementia. Prevention is always preferable. However, for people who already live with the disease, we must support not only them, but also their carers through its challenging progression. Mr. Speaker, in Bermuda, based on current processes, there are over 3,600 patients inputted into the Bermuda Hospital Board system having dementia. Work continues to better define prevalence data and the potential future impact on the Bermuda system. However, to date, as dementia is a progressive disease, people's needs for care and support increase, placing greater demand on our long-term care services and support over time. A lack of knowledge of the disease and support for those caring for persons with dementia can result in unnecessary and costly hospital admissions or home care placement. It also increases the risk for abuse and neglect, as cognitive impairment is a significant risk for such a factor. Mr. Speaker, it is within the context that the government is committed to addressing the social, clinical, and economic challenges of dementia. As such, the Ministry of Youth, Social Development and Seniors has undertaken the following related initiatives. In 2022, provided several education series on dementia. In October of 2023, introduced the Dementia Navigation and Care Pilot Program. In June of 2024, extended the pilot program based on the data obtained. In November 2024, developed a detailed project inception plan for the design of a Seniors Day facility with a dementia care focus. In December of 2024, completed the first national senior strategy for Bermuda, inclusive of a focus on dementia. In January 2025, contracted the expertise of the Bermuda Health Council to commence developing an integrated care pathway for dementia. And in February of 2025, engaged in meetings to start assessing the designated site for the dementia-focused Senior Day facility. Mr. Speaker, of these initiatives, it is the pilot program I wish to provide an update on today. In a previous statement made on the floor of this honorable House, I shared that in October of 2023, North Star Dementia was contracted to provide a 6-month pilot program for dementia navigation and support services for persons experiencing dementia who were either uninsured or underinsured. These services included comprehensive dementia assessments, personalized care planning, cognitive compensatory strategies, case management, caregiver education and support, crisis intervention and prevention. This program was developed based on evidence-based research that recognizes the vital importance and role of dementia care management, not only to improve quality of life for persons with dementia, but also their carers, which in turn decreases more costly care caused by hospitalization or crisis management. North Star Dementia was selected not only because they specialize in this area, but also because of their service model, supplements the pilot program to expand its reach and depth of support. Mr. Speaker, between 2023 and December 24, the ministry provided a total of $96,000 to fund the program, which contributed to serving 111 persons, of which dementia, 111 persons with dementia, of which 58%, or roughly 63 clients, were female. 55%, or 61 clients, were between the ages of 75 and 84 years of age. 67, or 74 clients, were Black Bermudian. For the caregivers who were clients and received services, 56% were the adult children of the client. 70% were female caregivers. There were a total of 260 client contacts during this period. The intensity and type of contact was tailored to the needs of the family and the stage of the dementia progression. Mr. Speaker, the question is, what have we learned to date about the need for dementia care service program? Based on a client feedback and data findings, the answer is in 3 key observations. 1, there is a funding gap for dementia navigation and support services. 2, persons are not getting formally diagnosed. And 3, caregivers are stressed and not getting enough support. Mr. Speaker, let me briefly speak to each of these 3 observations. 1, there is a funding gap for dementia navigation and support services. Nearly 95% of the clients in the pilot program were insured. However, 84% of all referrals could not contribute to the full cost inclusive of copay of the services. 2, persons are not formally getting diagnosed. At the start of the program, 46% of the clients stated they did not have a formal diagnosis. However, after participating in the pilot program, 77% had obtained a diagnosis. 3, caregivers are stressed and not getting enough support. At the start of the pilot program, 16% of the caregivers rated their stress levels as severe, and 52% said they were moderate. At the 12-month evaluation mark for those clients evaluated, 46% felt somewhat less stressed. 27% were significantly less stressed. 62% felt more knowledgeable about dementia. 77% were more confident in implementing care strategies for their loved one, and 73% were more aware of local resources available. Mr. Speaker, the pilot program highlighted to its clients the importance of being diagnosed to determine if one's experiencing dementia or not. This allows persons to prepare ahead and put their affairs in order, determine what supports will be needed, and get critical legal documents and financial resources in place. After starting the pilot, 65% of clients obtained a power of attorney, and 46% obtained an advance directive. Mr. Speaker, the pilot program outlined how persons can start interventions and finding support sooner rather than later. For example, there are available medications or programs that can help decrease the impact of cognitive decline early in dementia progression. Additionally, there are non-medical interventions to help manage behaviors or concerns that can reduce the need for costly hospital admission. Roughly 81% of clients in the pilot program had no hospital admission, and 46% had an increase in social support for their loved one. Mr. Speaker, it is important that family carers have the support they need to continue the care of their loved ones. Access to support groups, respite daycare, activity programs, and home care placement is needed. The pilot program demonstrated the critical role of system navigation and care management for family carers and persons living with dementia to provide support and guidance with direct care and available support services. This is evident by the 100% of clients evaluated stating the dementia care service pilot program should continue. Mr. Speaker, the pilot findings are only from a small sample of persons diagnosed with dementia. This is why our systematic work in collaboration with the Ministry of Health is critical for long-term solutions. Under the framework of the National Senior Strategy, the Ministry contracted the Bermuda Health Council to develop an integrated care pathway for dementia in collaboration and alignment with the Ministry of Health's health system reform work and the Health Council's Dementia Health Needs Assessment. This initiative is underway and is mapping current patient journeys and identifying systems and service gaps and needs. A preferred care pathway will be established in consultation with stakeholders, and an action plan will be developed. This pathway will cover prevention to end of life, as the entire spectrum must be addressed to not only reduce the prevalence of dementia in Bermuda, but also its negative impact on those living with the disease, their support persons, and the sustainability of our health and long-term care systems. Fundamental to this work is establishing a standardized formal diagnosis process to ensure we obtain the most accurate data as possible on dementia and its varying types. Mr. Speaker, in closing, I acknowledge and thank all of those persons living with dementia, their carers, and the service providers who have shared and continue to share their experiences, knowledge, expertise, and very limited time as part of this pilot program work for improving Bermuda's dementia care system for current and future generations. We look forward to updating this Honorable House and the community on the continuing progress of these initiatives. During the interim, I encourage our community to increase their awareness of dementia prevention and how to lend support to persons and carers, as well as the organizations in place that support persons living with dementia and their families. Thank you, Mr. Speaker.